Hello, it's me again. I'm back to you. It is Thursday, July 29th. I had my gallbladder surgery yesterday morning, and I'm still recovering from my cervical disc replacement a month ago on the March 24th. And my doctor said that it would be okay to get another surgery, which I did. So I got gallbladder removal surgery. It was laparoscopic. Everything went okay. Just kind of tired. I didn't get much sleep trying to recover from 2 different surgeries. This no longer, it's just more like tender right here, but that's about it. Sorry, my voice is a little hoarse from them putting that tube down my throat yesterday. Just coming to you to let you know that I'm doing good with this. I started physical therapy, so they're gonna, start making me do the range of motion and back in my neck, because I can do this and this. They want me to be able to look all the way over because I can't look in my blind spot. They said I can drive, but I'm not going to because I always check my blind spot, and I'm afraid that if I had to stop fast or had to think quick about something, I'm gonna be using my neck, and I could hurt myself. So I'm just gonna avoid that for as long as I can. Up until, whenever. But yes, I got my gallbladder removed yesterday, and I got 4 incisions. They did it laparoscopic. It wasn't as bad. It's just sore. I only took one pain pill last night. They gave me something before I left the hospital because it was outpatient, and I've just been like on bed rest. It's been hard for me to get in and out of bed because it just like feels like it's pulling. But I'm sure by tomorrow I'll be okay. It's just, getting all that gas out that they put in your stomach, that CO2 or whatever it is. And just on a liquid diet right now. I'm just eating chicken broth with crackers and a lot of water and Gatorade. Sorry. But yeah, it was easy. My doctor is Dr. Levitt here in Las Vegas. He's a gastrosurgeon. He's amazing. I think it was maybe a less than a 30-minute procedure, but it did last an hour and 45 minutes because of, by the time they get me back there, they got to prep me, mark my stomach where they were going to cut. Then he did it robotic assist. So they had to do all that. So if you want to look up other YouTube videos about laparoscopic robot assist gallbladder removal, I suggest you do. So then I'm the type of person that likes to see my surgeries before I get them, so I know it's being done to me. Even though sometimes some of it can be brutal, I don't care. I'd rather see what's going down on my body. So, but yeah, I just been relaxing. I should be good to go maybe in a day or two, as far as because they just glued my incisions. They didn't staple or sew them back, however you say it, whatever. They're just glued. So they said for me to take it easy for a while, so that's what I'm going to do. So I'm going to be recovering from 2 surgeries. Just one, well, at least this one, I just have to do physical therapy now. But that hurts because they have to break up all the all the what do you call it? Not the cartilage, but the scar tissue in here. So then my neck can move as it used to with looking down and looking up. I think that was like the looking down is what hurts because then I could feel it here. I can't move my head back a little bit, but not much. The Dr. Garber, who did my total disc replacement, just told me to tell my gallbladder surgeon to not have them tilt my head back because I just had surgery, and to be careful when they incubate me because there could still be some, swelling in there from, the cut and scar tissue. But when they did it, they had to shove everything over so it moved. They had to hold it and move it. So to get to the neck, to the spine. But like I said, the gallbladder surgery went well. It was fast for me. Like the waiting time before it was the longest to wait to get back in the operating room. But once I got in the operating room, I just remember them getting me on the little bed and putting my arms on these arm thingies, and I just started feeling something in my IV. Usually when I do surgeries, they put that little mask on you. And once they do that and they talk for a minute, I don't remember anything. But this time, I don't even recall them putting a mask on me. So I was just gone. I was out. And then when I woke up, they were like, Marina, wake up, wake up. And I was like in and out of it. Like this surgery, like other ones, I had no issues like waking up. Like I'd slowly wake up myself. But I guess they were just trying to wake me up because maybe I don't even know how long I was. I know I went in there at 11. They got me in the operating room like at 11:10, and then we didn't leave the hospital until 3:40. So it took an hour and 40 minutes, for 45, whatever, for the surgery, and then however long to wake up so I could be released. But I got up. I was just really dizzy because of the anesthesia still, just having to wake up that fast. She put me in, had me get dressed and everything out of the gown. And then she put me in a wheelchair, had to sign a few papers. Then she wheeled me out to my sister where she was waiting for me in the car. And then I got in there. They said that they put some injections in my stomach, like some pain medication in the skin. They said that they're starting to do that now, so it localizes it more. So then when you wake up, you're not in much pain. So they don't have to give you like morphine or anything like that. And it worked, like serious. Like I didn't have to take any pain pills until at night. And I wasn't even like in pain. Um, all I used was a Motrin 800, and that was it, and I was fine. And then today when I woke up, I was waking up in the middle of the night, of course, because of my neck, and then because of this, and then there's just times that I forget. I'm so concentrated on my neck, that I got up too quick and my stomach started hurting. Like I was like, oh man, I hope I didn't pull anything, or I checked my wounds to make sure that none of them like opened since they just were glued shut yesterday. I was afraid, but everything's fine. I've been putting an ice pack on it. My belly just feels numb on the bottom, and then just a little pain in the incision sites, which is expected. But and still the bloating from the gas. Got to get rid of all that gas in there. But I just been using an ice pack and doing a liquid diet. I probably will do that. They said I only had to do it for a couple of days, but I think I'm going to do it farther, maybe for a week or two, just to be sure, because I've always had digestive issues. But before this, my stomach was constantly feeling like somebody was jabbing or squeezing in my stomach inside, like, it hurt really bad, but I can't feel none of that anymore. We'll see. It's probably because I still have the pain meds in me when they did those injections, thank goodness. But and from the swelling and the numbness. Sorry, I didn't get much sleep last night or today. But other than that, everything went well. If you're thinking about getting gallbladder surgery, I highly suggest. I watched tons of YouTube videos with the different, answers or options. And you know what? It's basically up to you. Don't let nobody else scare you or say that, oh, no, because I've had it. My two sisters have had it. And no, it's not hereditary. Um, and then I had some friends that had it done that got their gallbladders removed, and they said they were able to eat anything that they want, chili, all that stuff, and it didn't bother them. So when there's these other people saying, oh no, if I eat this, I have to go to the bathroom right away and it's diarrhea, um, they've never had that issue. But like I said, you can. I also went online and saw some supplements, that you could take when you don't have a gallbladder anymore, because the gallbladder produces bile, which breaks down the fats in your food. So you can easily just, look online for a healthy supplement for gallbladder removal, and then it'll give you some. That's only if you're experiencing like digestive issues, eating a lot of fatty foods and fried foods, because that's what the bile did. But my doctor told me that even though you don't have your gallbladder, your body still produces bile. Maybe not as much, but it still produces bile. So if you just need that extra bile in your body to break down the fats, then I would suggest just, looking online, Amazon, and typing in gallbladder supplements. And then you'll see, or just Google the best supplements after gallbladder removal surgery. I found one. I can't recall what the name of it was. There was two of them. I just put them in my cart to save later, because I want to see how my body handles the foods that I eat before I start taking, these pills. Because even the doctor was like, it's basically up to you. So that's what I'm going to just wait and see how it goes. I'm not going to, do anything to my body yet. As far as supplements, if I don't need them, you don't waste your money, because your body will know. And if you start having issues with that, then, you just go get you a supplement, and then, get the ones with the most highest reviews, and don't get the cheapest ones. And because there's cheap ones that I've seen too that, that had really high reviews, had like 4 stars, and like 23,000, people bought it, versus, a real expensive one where it only got like 2 reviews on it. So just be mindful of that. Just check the reviews, you know, um, and don't listen to other people like on YouTube when they, because that's their body, You don't know how their body was before digesting food, before they had their gallbladder removed, because there could be so many other symptoms not caused by your gallbladder. Because I had so many issues with my stomach before. That's when my gallbladder was healthy. So you just gotta do for yourself, and that's that. But I'll keep you I'll check in with you guys in another couple of days. By then I should feel more perkier, like not as tired. Um, I'm like way overdue for sleep. Because when I had this surgery, it was so hard to sleep. Still is, because I have to sleep on my back. I'm a side sleeper. So I can't sleep on my side yet because they don't want all the weight on either side yet. So they told me to do a few physical therapy sessions first. My first one that I did last week was just an assessment. They just wanted to see my range of motion, and there's no physical therapy required for after your gallbladder removal. I have my appointment for that next week. Or no, not next week. Wait, what is next week? Oh yes, next week on Wednesday, a week after. Yes, and then he's going to tell me everything. So I'll probably come to you guys back in a couple of days. So you can see how the healing of the scars are. They didn't even have to put the little steri strips on them. They just glued them. I still have like washcloths, antibacterial that my last doctor gave me to wash my body with because I can't get these wet. I still got those bandages too, that go over like I put on here when it was first fresh. It's like a waterproof sealed bandage, clear, that went over this, and it helped too. So if I really feel up to it, I'm just so tired. I can take a shower tomorrow or Saturday. We'll see how it goes. If not, I just been using those sterile bath towels that they gave me. They're already pre-moistened. They're pretty cool. They feel nice. They're nice and soft. But I'll check back in with you guys in a couple of days. If you guys got any questions, just feel free to comment, like, and subscribe to see if any of my other videos popped up. Hope you like this. Thank you. Bye.